Hello everyone, welcome back in value added course on pain management. So my topic is brain and spinal cord stimulation. So this is the outline for the session. It contains introduction of the topic, that is brain and spinal cord stimulation. We'll see about the anatomical and physiological review pertaining to our topic, various brain and spinal cord stimulation techniques which we have, their techniques, their indication, contraindication, and complication of this we'll see in detail. Along with that, role of nurse in pre-operative, post-operative, as well we can see before procedure, during the procedure, and after procedure. So along with that, rehabilitation and the health education, patient education, what are the things we can educate to the patients, family members. Okay, we'll see into that. Later on, we'll see the role of nurse in holistic care. So definitely, cancer pain means the chronic condition. Definitely holistic care. It will involve into that. So what are the role of nurse in holistic care? That also we will see in detail. We'll see the summary of the topic at the end and the conclusion, and later on we'll see the question and answer session. So starting from the introduction of brain and spinal cord stimulation. So here we can see the cancer pain is a very pervasive and the debilitating symptoms that profoundly impact on quality of the patients. Why we can see the patients who is suffering from the cancer and the cancer pain, they are completely, their quality of the life are disturbed, and along with that patient is suffering from the chronic pain. So these are the techniques for which we can useful for the cancer patient as well the patient who is suffering from the chronic pain. Later on we see the traditional pain management is a strategy, while effective for the many, often fall short, and those are experiencing severe neuropathic pain, intractable pain. Brain and spinal cord stimulation therapies are innovative techniques which use in neurological rehabilitation and pain management. Why the neurological rehabilitation? Because a certain disease condition like Parkinson disease, epilepsy, or we can see the neuropathy, neurological conditions. Definitely that time also these brain and spinal cord techniques are very important. Along with that, for the pain management. So these stimulation techniques are include methods like transcranial magnetic stimulation, deep brain stimulation, spinal cord stimulation, and the epidural stimulation. These therapies are widely applied in conditions such as Parkinson disease, depression, epilepsy, chronic pain, and spinal cord injury. As a nurse, we require principal indication, contraindication, their complication, their management, their care. All the aspects are very crucial in the pain management. So, as a nurse, we should know these are the things. So right now we can see in the picture we have the anatomy of the brain, where we can see the lobes of the brain like frontal lobe, limbic lobe, parietal lobe, and occipital lobe, where we can see the spinal cord attaching with the brain. Here medulla oblongata, that we learn in the semester 1, that is in anatomy of the brain in the nervous system. So this is the anatomy of the spinal cord, where we can see the spinal cord is connected to the brain. Here these are the parts, that is the cervical region. We have the thoracic, that is a T1 to the T12, lumbar, that is from L1 to L5, sacral region, that is S1 to S5, that in last one, that is coccyx. This is the spinal cord we can see. So normally physiological things of the brain. So function of the brain, that the control center of the body, it is responsible for the thought, memory, emotion, sensation, and motor control. These are the things are responsible. These are the things are responsible for the brain. So this is the major parts, that cerebrum, higher cognitive functions, voluntary motor control, sensory processing. It is maintained by cerebrum. What? Who's maintaining this? Cerebrum. What about cerebellum? Cerebellum is responsible for the balance, posture, and coordination of the body. Now, if we wanted to stand, walk, our body posture, who is responsible? Cerebellum is the responsible. Talking about brainstem, it regulates breathing, heart rate, consciousness, etc. Brainstem. If the person is suffering from the unconscious, or we can see the in the ICU person, many patients are unconscious because of the certain cause, because of the certain disease condition. Means who is affected? This the person's brain stem are affected. Then definitely it will change into the changes in the consciousness. That is, it can go to the unconscious, it can be the semi-conscious, or person can be remain same normal like a conscious. Also responsible for the breathing and heart rate. Basal ganglia and thalamus, it is responsible for the movement control and sensory delay, important to the neurostimulation therapies like DBS. So physiology, or we can see the function of the spinal cord, it extends from brainstem to the lower back. Now here we can see this cursor here, this is the brainstem. Okay, it is connected from here to the lower part, that is coccyx. Okay, this part called it as spinal cord. The function of the spinal cord is that to conduct sensory input from body to center, that is the brain. Means sensory input from all over body part like leg, hands, okay, okay, peripheral body part. Okay, these are the impulses, these are the sensory inputs are passing from all over body part to the brain stream, or we can see to the brain. Later on, next thing, that is the transmission of motor output from brain to the spinal cord, or we can see the brain to the various body part, that is the peripheral body. Okay, it is the transmitting the motor functions. So next one, that is the controls reflex action without brain involvement. So talking about brain and brain stimulation techniques. Brain stimulation techniques are advanced medical procedures that use electrical or magnetic impulses to influence brain activity. What happened? What is the actual action of this stimulation techniques? That means what? Normally the brain functions, that is electrical activity, electrical impulses, it is a continuous going on. But what happens in the pain, if the person is suffering from the severe pain, these techniques are diverting, okay, diverging these impulses and the influence to the brain activity. So definitely the if person is suffering from the pain, so the pain will be divert, okay, and patient will feel relaxed. So this is the main action or mechanism of these techniques. They are applied when conventional treatments fail, mainly in conditions like Parkinson's disease, epilepsy, depression, OCD, and chronic pain. These techniques may be non-invasive, such as transcranial magnetic stimulation, invasive, such as deep brain stimulation and vagus nerve stimulation, also epidural stimulation. So their primary mechanism to the modulate abnormal neural signals and restore balance in the brain circuit, thereby improving movement and mood seizures control. The advantages include significant symptoms relief and better quality of life through the complication like infection or device malfunction, and it occurs in invasive method. Nurses plays a vital role by preparing patient, assisting during the procedures, monitoring for the side effects, provide education, offering the psychological support. So first one, that is a transcranial magnetic stimulation. It is a non-invasive technique, means what, there is no anything inserted into the body, or there is no anything inserted into the skin. Now we can see in the diagram there is a brain, and this is a one of the device. Okay, uses of the magnetic field applied over the scalp to stimulate nerve cells in the brain. So here this is the magnetic magnetic things is there, magnetic force is there, which we can keep on the patient's person's scalp, and it can stimulate the nerve cells in the brain. Definitely the patients can feel relief from this. So indication for this procedure is like depression, migraine, stroke, rehabilitation, and OCD. Advantages like safe outpatient, no surgery is involved. Role of nurse in that we have to prepare the patient, explain the non-invasive nature, monitor for the mild side effects, headache, scalp discomfort, provide psychological support, etc. So second thing, that is a deep brain stimulation. In that it is an invasive procedure, means what, we can see in the diagram there is a things are inserted into the person's brain. Okay, it is an invasive procedure. Electrodes are surgically implanted into the deep brain structure, like example, thalamus, subthalamus, nuclei, globulus pallida, or any part of the brain where the electrode are surgically inserted. Normally we are doing operation of the brain. Similar kind of things, the electrodes are implanted into the brain part structure of the brain. Device like pacemaker that delivers the continuous electrical stimulation to the brain. And indication for this procedure is called the indication like Parkinson disease, essential tremors, dystonia, and epilepsy. These are the disease condition. These are the indication where deep brain stimulation we can perform. So the advantage of this procedure is that reduced tremors, stiffness, abnormal movement. Okay, so these are the advantages of this. And rule of nurse, in that we have to perform rule of nurse, that is in three phases, that is pre-operative, intraoperative, and post-operative. In the pre-operative, we have to provide family education, patient education, we have to take the concern, we have to clean, shave the body part, we have to see the neurological basic function, we have to see the GCS. Is all those things related to the patients we have to do in the pre-operative phase. Now talking about intraoperative monitoring, we have to do the baseline management, we have to do the vital management, we have to see the consciousness of the patient means, and we have to see the surgical aspects, surgical side technique. All those things we have to see in the pre intraoperative phase. Talking about post-operative phase, that is in the post-operative phase we have to monitor the patient's vital signs, we have to see the for the patient diet, we have to see the for the patient's lesion, we have to see the sutures, we have to see the wound dressing, hemorrhage, that all those things we have to see. Along with that, the device malfunction means what, we have inserted the electrode inside the part of the body, whether the received device is working or not. That important things we have to assess in the post-operative phase. Talking about long-term care. Long-term care means what, that electrode, that is a device is inserted into the part of the brain. Definitely we have to take care of the device, medication compliance, counseling, etc. So this thing we have to do in the brain, deep brain stimulation. So now we can see diagram of the vagus nerve. So next technique is that vagus nerve stimulation. But here we can see, so this yellowish part, okay, this yellowish part called it as vagus nerve, how it is diverted, located. So vagus nerve, next thing, that is a vagus nerve stimulation. In that it is implantable device placed under the chest skin. Where we are pasting, this is the chest region where we can see, okay, the cursor is moving here and there. This is the region of chest, and this, in this diagram you can see, in the chest region the implantable device are placed under the chest skin connected to the vagus nerve in the neck. It sends the electrical impulses to the brain area which are involved in the mood and seizure control, mood stabilizer and seizure. For example, person is suffering from the mood disorder as well as the seizure control, so that time these electrical impulses sent to the brain region and the changes can be occur. So impulses can be changed. Similar kind of the things, the pain is occur, definitely the pain can be modified, pain can be diverted. So indications like refractory epilepsy, treatment resistant depression, along with that cancer patient or surgical side, or we can see the person who is suffering from the neurological pain, neuropathy. Advantages is like reduce seizures frequency, improve moods, role of nurse. Again, same role will be there in the pre-operative, intraoperative, and post-operative phase. Next is that spinal cord stimulation, that is a SCS. Definition pertaining to that, or we can say about the spinal cord stimulation, in that spinal cord stimulation, it involves in implanting electrodes in the epidural space, where you can see in the diagram there is a epidural space. Okay, so if spinal cord stimulation involves implanting electrode in the epidural space near the spinal cord, which deliver electrical impulses to block or modify pain signal before they reach to the brain. Now, for example, the person is suffering from the injury or the pain at the lower part of the body, and the sensation is passing through the spinal cord to the brain. So what happened, we have to place this device, we have to place this electrolyte in the epidural space near to the spinal cord where the injury down part of the injury or we can see the which deliver electrical impulses or block the modify pain signal. Okay, means before sending to the brain, this the impulses can be stopped and can be blocked by this electrode, called it as spinal cord stimulation. Indication for this, the chronic neuropathic pain like failed to back surgery, the person is suffering from the back surgery, it is the surgical site since, or we can see the spinal cord surgery, that time also we can use this thing. Complex regional pain syndrome, peripheral neuropathies and refractory angina, as well the ischemic limb pain in selected cases like amputation. So later, what is the action, or we can say the mechanism of these impulses? It creates a mild tingling sensation like paresthesia that makes a pain signal, modulates pain transmission pathway in the dorsal column in the spinal cord. Advantages of this: reduce chronic pain, improve quality of life and the mobility. It may reduce long-term dependence and the opioids of the analgesic, because the person is taking long term treatment. For example, take an example of the cancer, person is taking chronically, patient is taking medication, taking NSAID, taking opioids, so that time this technique can useful for the patient. Next thing, that is epidural stimulation for the spinal rehabilitation. Epidural, it stands for the epidural stimulation. It's a techniques where the electrodes are implanted on the dorsal aspect of the spinal cord in the epidural space to activate the spinal cord circuit below the level of injury. Normal, for example, we can see the red-like structure here. So here the injury to the spinal cord, and now we have to connect this device, connect this electrode to the before the injury, before lower part of the injury. So this is the about epidural stimulation. The indication for this, that the injury to the spinal cord or the paralysis, major rehabilitation in the patient with the partial movement motor function, research based on the restoration of the standing, stepping, bladder, bowel movement. Mechanism or action, we can see electrical impulses stimulate the dormant neural network in the spinal cord. It helps to re-establish communication between brain and body below the injury level, and it it's when it combined with the intensive physiotherapy promotes recovery of voluntary movement. So these are the mechanism of the epidural stimulation. Advantages of is its enhanced motor recovery and functional independence. What advantages? Enhanced motor recovery and functional independence. For example, where the motor sensation is lost or motor things are damaged, so definitely the things can be recovered properly. Improve the bladder bowel function, sexual function, as well as in the some patient. It provides a rehabilitation for the spinal cord injury, and the person is suffering from the injury to the cervix, or we can see the cancer type of the pain. So next thing that we'll see about the role of nurse in all those things like brain and spinal cord stimulation. This is the overall role of nurse in the pre-procedure care. We can see the assessment of medical and psychological status. In the medical means what, we can ask to the patient, we can ask to the family members pertaining to the what is the past medical history of the patient, so we can identify and we can this data we can helpful for the for the establishment of the diagnostic. Next thing, about the psychological status of the patient as well as the psychological condition of the patient, we have to maintain, we have to provide psychological support to the patient, educate family and educate patient and family about the procedure, because we require we have to establish the good IPR with the patient, then only we can able to take proper history, we can get adequate data of the patient. Preparing surgical site and ensuring the informed consent, maintaining fasting and preoperative checklist. These are the things are there in the preoperative phase. About intraoperative care, assisting neurologist or neurosurgeon during the procedure, during the care, we can see we have to help to the surgeon, monitoring vital signs, ensuring the patient safety, maintaining aseptic techniques and patient comfort, because we have to we are performing any surgical intervention, definitely we have to take care of infection, we have to take care of hemorrhage, we have to take care of blood loss, we have to take care of blood vital signs, and we have to take care of anesthesia. And generally we should know the patient comfort, etc. In the post-operative phase, what are the things we have to keep in mind? Generally, we have to see about the vital signs along with the pain management. Person is suffering from the pain, patient consciousness, patient hemorrhage, patient's wound condition, patient's wound status. Okay, like all those things we have to keep. All those things we have to keep in mind as a nurse in post-operative care. We have to managing with the pain in the infection. We have to manage the pain and infection prevention. Definitely, we have to start with the antibiotic, and we have to follow the doctor's order. We have to start with the medication as per the doctor's advice. Doctor may be advised the antibiotics, analgesic initially, that we have to start immediately. Early mobilization with the physiotherapy support. Definitely we have to talk about the mobilization also, physiotherapy, and the drain also. So device care and monitoring malfunction. Definitely if you are inserting any device in the if you are using any device, definitely we have to take care of that device for the malfunction and the productivity of the result. Talking about rehabilitation and education, in that we have to coordinate with the physiotherapy, occupational therapy, patient safety, family education, lifestyle modification, and long-term follow-up for the psychological support. These are the things we have to add. These are the things we have to see in the rehabilitation, in the education. Role of nurse in holistic care. Definitely, if the chronic pain is there, chronic disease condition is there, cancer is there, long-term treatment is there, definitely holistic care it will take part, and that time role of nurse in holistic care is very important. So as a nurse, we can provide a patient advocacy. We have to maintain as advocacy and communication with the interdisciplinary team, that is a physiotherapist. We have to talk with the lab technician, we have to talk with the psychologist, we have to take the rehabilitation, with all the interdisciplinary things, those who are involved into the patient this is patient management. We have to take care of that. We have to communicate with them all the about patient. Talking about psychological counseling, we have to provide psychological support to the patient as well as the family support as well as the family, because psychological aspect is very important in view to holistic care. Later on, we can talk about support to community integration. So vital, it is a important thing that what are the community resources available, what are the community routine practices are available, and according to that we have to put that patient into the that integration, and we can provide maximum care to the patient and satisfaction as well as the psychological support in the holistic care. So we'll summarize the topic in that today we saw about the brain and spinal cord stimulation. These are the advanced therapeutic approaches which are using managing the patient with neurological and chronic pain disorder. Initially, normally we can just give the analgesic, just we can divert the patient mind, just we can talk with the patient, and with which we can helpful to patient pain management. But in the chronic pain such as neurological pain, neuropathy pain, as well as we can see the chronic cancer pain, that time definitely we have to use this kind of stimulation techniques which can useful for the patient. What are the techniques we saw? That is a transcranial magnetic stimulation, that is a TMS, deep brain stimulation, that is a invasive stimulation techniques. Vagus nerve stimulation, it is also one of the invasive techniques where we are implanting the electrode to the vagus nerve. Later on we saw the spinal cord stimulation and the epidural stimulation. These are the techniques useful for the brain and spinal cord stimulation. These are the applied condition like cancer pain, Parkinson's disease condition, epilepsy, chronic pain, and spinal cord. Okay, normally like a cancer pain as well as some neurological disease condition where we can use these techniques. For the nurses, what are the important things? As a nurses, we have to keep in mind, we have to see about the preoperative phase. Preoperative phase, all the things are included. It starts from the taking vital signs to the sending patient to the operation theater, or we can see that is to the operation room. All the things like taking height, weight, taking vital signs, doing BMI, taking advising patient diet, take preparation of the skin, preparation of the body part, all those things are included into the pre-operative phase. In the intraoperative phase, we have to look for the vital signs, we look for the patient surgical side, we look for the patient bleeding, we have to measure the patient's output as well as whatever the fluid has been provided to the patient in the form of IV fluid, that also we have to monitor, as well as we have to maintain the surgical site checklist, we have to maintain all the surgical aseptic techniques during the procedure. Last point, that is the post-operative phase. In the post-operative phase, we have to monitor the patient vital signs, we have to see the patient output, we have to see the patient consciousness level as well the patient pain level. And later on we can talk about the rehabilitation and patient education and the family education. This was the overall summary of this topic. So here I'm concluding that the brain and spinal stimulation therapies represent modern advance in neurological rehabilitation and pain management, because initially these are the things are not available. Right now we can see the modern advancement are there in the medical field, definitely. So these therapies, these technique we can use in the stimulation. Nurses plays a vital role to ensuring successful outcome by providing scientific, compassionate, and evidence-based care throughout all the space. Means through all which phase, that is the pre-operative, intraoperative, and post-operative, or we can see the pre-procedure, intra-procedure, and the after procedure. So the nurse's role is very important, because we know that if we are missing anything, definitely it will harm to the patient. Patient can be get infection, patient vital signs can be changed, we can see patient can be go to the complication. So nurses plays are the very vital role. So with the proper knowledge and skill, nursing professional can significantly contribute to the with improvement of the patient quality of the life, support to the patient, and interdisciplinary approach, interdisciplinary teamwork in the neuro rehabilitation. So these are the things we saw today. With this I am ending with my topic. Thank you.